Hey everybody, welcome into the first Caregiver Journey Conversation by Carallel for 2023. Matt Perrin back with you, Director of Caregiver Engagement here at Carallel. And looking forward to today's discussion where we'll be talking about caregiving, caring for a loved one after discharge from the hospital. So we'll be talking about what makes it so intense and what we can do about it as caregivers to hopefully make it a little bit easier on ourselves. So I have what if you've been to these sessions, what should be a familiar face joining me today. Perry Mimms is back for another episode. Hey Perry, how are you?
I'm great. I can't get enough of these.
Yeah. Well, I appreciate it as always. And Perry, for anybody that's seeing her face for the first time, Perry is a care advocate here at Carallel. She's also spent time in a past life as a care transitions coordinator. So really excited to get her perspective from both her past experience helping people and families through transitions, but also her day-to-day current experience of working with the caregivers that we help here at Carallel. So thanks for joining me, Perry. And let's just get through the housekeeping real quick so we can jump in. How's that sound?
Sounds good to me.
All right, perfect. So if you're joining one of these sessions for the first time, thanks and welcome. We're really happy to have you here. We are Carallel. We're a company that makes caregiving easier. And we do that in a couple of different ways. Number one, we provide personalized one-on-one support via the phone, email, or chat with our team of care advocates, again, which Perry is a part of. And we complement that human support with a digital platform called My Care Desk by Carallel, which is really a one-stop shop for anyone that's caring for a loved one, where they can do everything from store important documents, keep track of task lists, ask friends and family for help, or read educational content or watch educational videos. So My Care Desk by Carallel is our digital platform that complements the human one-on-one personalized support we provide via our caregiver support line. We make our service available through health insurance plans and employers across the country. So if you're not sure whether or not you have access, ask your health insurance plan or your employer. The second piece, these are conversations. We use that word intentionally. They're not presentations. These are conversations about the challenges that we face as caregivers, the opportunities we have as caregivers. But they're, operative word being these are conversations. So please join. If you have perspectives to share, questions to ask, please drop them in the chat in your GoToWebinar console. There, I think that's it for housekeeping, Perry. So I think we're ready to get into the conversation. We'll start with a poll per usual. I'll just get a sense for what prompted people to join us today. This is always helpful for Perry and I to have a sense of. And just curious for the future is winning the day. So got about 80% of the vote. Oh, now we're split, about a third and a third and a third. I'm currently caring for a loved one after a hospital stay, currently have a loved one in the hospital, or I'm curious for the future. So I'll go ahead and close that out. Glad you're here. Regardless of your motive for taking the time to join us, glad you did that, and hopefully you find the time useful. So per usual, we are really just in these conversations focused on the practical. So today that means everything, starting with number one, what do we mean by discharge, right? Might be obvious to some, but it has different meanings, every circumstance is different. And then we'll talk about, we'll just step back and take stock of what makes caring for our loved one after discharge so intense. And then we'll spend the bulk of the time talking about some things we can do to dull that intensity, to make things easier on us. There is no magic wand, unfortunately, but there are practical things that we can all be doing if we find ourselves in this situation to lighten the load even just a little bit. So, you all good, Perry? You ready to get started?
Absolutely.
All right. So first things first, Perry, what is discharge? I mean, obviously it's leaving the hospital, but can you talk about, a little bit about what we're meaning by hospital discharge here today?
Sure. Well, I'm going to answer your question in a completely different way and just say it also depends a lot on what kind of hospitalization you're dealing with before you can even think about discharge. So, I mean, there are emergency hospitalizations, there are planned procedure hospitalizations, there are long haul where somebody has been hospitalized for a significant period of time. And all of those things are going to go into the discharge from the hospital. Something that I've seen be more difficult than others, if somebody's just admitted to an ER, the discharge from there might not be as holistic as somebody that was an inpatient hospitalization. So that's something just to set the stage for a second. And then there are all different types of discharges. You know, are you going to a rehab facility after your hospitalization? Are you returning home? In what condition are you leaving the hospital? So all of those things kind of go into it. But when we talk about discharge, we really just mean leaving the hospital, being discharged from the hospital itself.
Yeah, and it's a transition in the level of care, right? When you boil it all down,
Mhm.
it's a transition of the level of care, which sort of leads us to the next piece as we talk about sort of the intensity of the load that we as caregivers carry at this point in time. Um, Leaving the hospital doesn't necessarily mean we're healthy today, right?
No.
It's in fact it more often than not it probably doesn't mean that a person's healthy. It means that they no longer need the level of care that the hospital provides. I've heard you say that. I just wanted to draw that out.
Yeah, and it's something that we've talked a lot about with a lot of our caregivers and, you know, internal training for our care advocates is just because somebody's discharged home doesn't mean they're back to the status they were before the reason for the hospitalization. A lot of times these are traumatic events, no matter what kind of hospitalization it was, and there are long-term effects from that. Um, the person who was in the hospital most likely has different care needs, whether those are short term after the hospitalization or going to be continuous are different things also. But most of the time, when you walk out that hospital door, you are not the same person in that moment that you were before you walked in.
Yeah, we all hope and wish we are, but the reality is that at least temporarily, we probably aren't, right? So it's a great call out. Now, what, and you're kind of getting at something there, um, because oftentimes, if we're a family caregiver um, who's already been doing the work of helping a loved one, whether that's a little, a lot, somewhere in between, um, this is a entirely new sort of set of responsibilities, a new mission, I've heard you say before. Um, for somebody that's already been doing the job, right? Who might be exhausted, might be frustrated, might be just already close to tapped out. Um, and then you add to that sort of we're not always, I can think back to hospitalizations for my mom where um, I'm just sort of on adrenaline, right? And not necessarily, and this isn't necessarily the fault of anyone, but I'm going home with these new responsibilities and the need to address new needs for my mom, and I wasn't necessarily prepared for that, right? Which that dynamic of added piling on really just, from my experience, added to that intensity.
Okay, to start, hospitalizations are extremely traumatic, not just for the care recipient, but for the caregiver. Often during that time, people are suffering from a lack of sleep. It's emotional. It's scary when your loved one needs to be hospitals and hospitalized, and I really do want to take this from the angle of the caregiver, not the care recipient, right? Or the loved one. So maybe before this hospitalization, you thought things were going all right. And now you're faced with this whole new experience. There could be a new ailment. There could be new precautions related to it. Your loved one might now need a new level of care. When you're exhausted and you're in this kind of busy hospital experience, sometimes you feel that you get different outlooks from different staff members. Like there's a lot of things that, and trust me, I more than anybody, if I have somebody that I love that's in the hospital, man, do I want to listen to the best prognosis, the best possible outcome from that person. But it's important to listen to all and like take in all the feedback from all the professionals to help kind of balance how you can decide that, prepare yourself to move forward from that point. But in general, it's a whirlwind, and there's a lot of different things to keep track of. You might be talking to a case manager, a physician, a hospitalist, and you're just trying to stay on the same page. It's a lot of information for one person to try and manage. And then when you're faced with the discharge, if you don't feel that you are super comfortable and clear on the discharge plan itself, you're just going home with more questions, right? So I know, I'm sure we'll talk about it in a couple minutes, but really getting to know the discharge planner, whether that's, they go by different names in a hospital, the discharge planner, case manager, social worker, whoever that person is that's kind of overseeing the discharge so that it'll be a safe and successful discharge for your loved one, is a really important person to get to know.
Yeah, I so I couldn't agree more. And in my experience, when I would get, it's just so much easier to address a lot of those questions that you're talking about and referring to while you're there versus while you're at home or at some other facility. And for me, this isn't the same for everyone, but for me, that sort of that just sort of had a snowball effect, because it was more challenging to get these questions answered when I was not physically there. And I would get frustrated by that because I didn't do necessarily the best job of I would just get frustrated. I'll leave it there. And, as maybe we all do, but it's just so much easier to tackle some of these things while we're there ahead of time versus after the fact.
Yeah, it's a big part of advocating for your loved one, right?
Yes,
And
yes,
it
yes,
is
yes.
easier to do in person. I've called hospitals afterwards to try and get the answers I need, and they are working with the people that are there in the hospital currently. I don't think that's for lack of effort. I just think realistically, when you're in front of somebody, you're going to get better answers.
Yeah. So you've just painted a good picture for us, Perry. So let's sort of segue, because we're about half time now. Time flies when we're having fun. But let's segue into some of the things that we can be doing to make it easier. And I want to definitely touch on the discharge planners and some of what you were hitting on. But before that, one thing that I wish I had done, and we were talking about this prior, was keeping primary care posted as about what's happening. And that was like one of those moments for me, like, man, I should have done that. It was like almost hearing that brought me right back to those situations. If for no other reason, right, I could see how there could be some comfort, right, in someone else knowing about what was going on, someone professional who knew my mom, in my case, right? Yeah, that's one tip. And then what about the documentation piece is really important. And hopefully, and I didn't, but hopefully people are sort of more efficient at this sort of stuff than me, but hopefully people have sort of the documentation in place with their loved one's insurance, for instance, that makes it easy for us to talk with them as a caregiver.
I think of documentation as such a big part of caregiving, But as far as having things in place so that you can speak with the insurance company, that's really helpful, especially if your loved one is going to go to a rehab or is going to need home health set up, or if there's ongoing concerns about the home care that's, coming in, or physical occupational therapy, any of those things. But that's just the insurance company. I mean, having power of attorney for healthcare is
Mhm.
really it is not a difficult document to work with usually, and it is so helpful. So in the case that your loved one is in the hospital and decisions need to be made, that you're able to do that on their behalf.
Mhm.
So that's another piece of documentation. I mean, we could go on for hours on this one. An up-to-date medication list, like all these things are super helpful when you're in the hospital, because oftentimes medications change when you're there.
Mhm.
You're going to go home with a different medication list than you went in with. So I guess documentation in general is really important, but yes, there are some key ones that are super helpful given this type of situation.
Yeah, you just hit on two there. The way I came to have, again, I'm an only child, uh, caring for my mom. This was before I was, in a quote unquote caregiving role. My mom had a hospitalization. It was an emergency situation. We didn't have healthcare power of attorney set up. We didn't have those things in place. So thankfully everything turned out all right. And that episode was sort of what compelled us to get that stuff done after the fact. But and the other thing you hit on there on documentation is medication list, right? I didn't have that either, which would be tremendously helpful. And as things change, to your point, during the medication, keeping a log of it or getting it from the healthcare team that's providing care. And we just did an episode at the end of last year on medication management and ways to make it easier. But I'm glad you mentioned that. So now let's get into the discharge planner. And because I'm really interested in your perspective on this. I have some thoughts, um, but they might go by different titles, right, at different hospitals.
Yeah. So sometimes it'll be the discharge planner.
Yeah.
Sometimes it'll be known as a case manager, a social worker. Sometimes it's the nurse, like the primary. It depends on what hospital you're at. At smaller hospitals, it might be the head nurse on the floor.
Mm-hmm.
Um, but in a lot of cases, they are known as the discharge planner because that's exactly what they do. Their role is to help prepare for a safe and successful discharge to the next level of care, whether that's home or rehab or something in between. It's somebody that's going to make sure that you have the medication list, make sure that the home health is already set up. If you're going to a rehab, that the rehab has all the documentation in place to accept you and help set up transportation for you to get there. I mean, this person is really in charge of the majority of the logistics in the moment of discharge and shortly thereafter. So setting up those things that your loved one is going to need in wherever they go, so that it is, a safe, I know I'm repetitive, but it really needs to be a safe and successful discharge. I talk to people a lot of the times who weren't clear on the discharge plans when their loved one gets home, and it is just, there's so much confusion and fear. And so really getting to know this person and making sure that everything is in order prior to discharge is 100% the way to go if you can.
I love that. And there are two things that I want to sort of expand on a little bit. Number one is um, the variability in titles, what this person who's responsible for a smooth discharge is called. Um, and so maybe that's the first fundamental question, right? As you're in the hospital, who's responsible for transferring mom or dad or my partner to wherever they're going next, be it home or some other facility? Who's responsible? So asking that question. But the second is, and you said, you used the phrase "get to know," and I couldn't underscore that enough in terms of importance. And we've talked about this, and this is a common thread through most of the conversations we have around, in this series and just on caregiving in general. But this notion of building relationships, right? And being being intentional about trying. Yes, not everybody is, we can't do it with everyone because some people just aren't receptive. Like, there's lots of reasons, but making the effort to build a relationship with that person that you find out is responsible for the transition, is just incredibly, incredibly valuable on so many different dimensions. Not the least of which is, it makes it a little bit easier to ask the questions. And this is something that is critical going through this period is if we have questions, asking them, no matter what, no matter if we think they might be silly questions. It doesn't matter if it's unclear. We as the caregiver need to be asking about it. So those are the a couple of main takeaways for me there, Perry, is identifying who that person or these people are that are responsible for the transition, but really intentionally trying to build a relationship with them. And
yes, and
yeah,
also being extremely clear about what is already in place. So a lot
yeah,
of times we talk about somebody going into the hospital and they do have a family member that's checking in on them 3 days a week, or helping them make sure that they have dinner on certain days of the week, or different things like that. But also being extremely clear on what they don't have. Nobody lives with them 24 hours a day.
mm-hmm.
They don't drive. So different things like this, because again, maybe their needs have changed, and this is something that we see a ton. Is something was sustainable before with somebody visiting 3 times a week and checking in, and now this person really needs 24 hours a day
Mm-hmm.
supervision. But what the case manager sees, or the discharge planner sees, if they don't have a conversation with you, is family helps in the home.
Mm-hmm.
So they're going to make the assumption that they can discharge them home because family has help in the home. That it's not the help that they need. It's not that they need now. It's not a sustainable maybe level of help anymore. And so being very clear about the barriers and buffers, we call them that, the barriers, the things that are getting in the way of somebody being successful at home, and the buffers, the things that are going well, and just
Mm-hmm.
being very upfront about them. So there's no lapse in communication of what they can expect from the caregiver upon discharge home.
I love it. I love it. And I love that terminology, barriers and buffers, kind of rolls off the tongue. So we have 6 minutes. So let's spend the time. Well, first off, just one more call for questions. Perry and I have been just on a roll doing our thing here. If people have questions, perspectives to share, please do share them. We'd love to address them live or after the fact. There is a handout in your GoToWebinar console. It's a hospital discharge checklist. So please do, especially for the portion of people that are on the call today that have a loved one currently in the hospital, please do download that. I think it could be a useful thing to have in your tool belt, so to speak. But let's spend the rest of the time, Perry, talking about questions to ask this discharge planner or some other title, right? And let's just, I think we came up with a list beforehand. Let's just go rapid fire to make the most of this time. How's that sound?
Sounds good. You go.
All right, we'll call it the lightning round. We'll call it the lightning round. So what setting will my loved one go to? Of course, you've talked about this, but are they going to another facility? Do we have a choice, right? And this speaks to some of what you're getting at there in your comments just a minute ago. So that's a really, really important question to ask. All right, you're up.
Oh, okay. So is there a list of providers for fill in the blank, durable medical equipment, home health, physical therapy that you have referred in the past that you have gotten good reviews back on? There's nothing, it's always helpful if you have an idea of a company being successful and helpful and good versus just, going on Google and trying to find somebody.
Love it. I love it. And yeah, I love the last piece of that too. Good experience, like asking them for their opinion, getting them to actually make a recommendation. So related though, what equipment will my loved one need is another question.
Mm-hmm.
To the hospital team, it may be obvious. Maybe it's even obvious to some caregivers who are seeing a situation, but it can't help to ask that question. And what will they need now? and what might they need a week from now, or 2 weeks from now, or a month from now? So
Mhm.
that's another important question.
And then I'm going to go rogue here, and separate from questions that you just want to ask the discharge planner is get to know your insurance company and the community around you to find out if your loved one is eligible for non-medical care in the home, personal emergency response systems like buttons to press if they need help, meal programs. I'm seeing a lot of Medicare plans right now that are offering a couple weeks after a hospitalization, they're sending meals to the home, so it's one less thing to worry about. So get in touch with insurance and ask those questions too. Anything that you are eligible for or your loved one is eligible for, take it.
Yes, great ad. I love it when you go rogue, Perry. Um, great ad. The so another, and I'm just looking at the time. Well, actually, hold on. I see a question coming in, and this is about. Well, first of all, question asker, very glad that this is good timing for this session, and glad you're finding it helpful. I will follow up with you after the session with some recommendations. Question was really on book recommendations, actually, or I might expand that to say book or resource recommendations, which I think, Perry, we can certainly help with, related to the types of transitions that we're talking about here. So thanks for the question. I'm just looking through our list of questions. So a couple of important ones left on our list, Perry. And this may be related, but asking explicitly for help in understanding what might or might not be covered by insurance.
Yep.
So sort of a different angle or adjacent angle to the question that you were just talking about around finding everything that you have access to and taking advantage of it. But
Yep.
this is an important one. And this ties back to earlier in the conversation around having the right paperwork documentation in place so that we as the caregiver can talk with our loved one's insurance, etc. And then another really important question, I think, that I wish I asked, but can the doctor or anyone on the care team, can they write prescriptions for any home health that might be needed, outpatient therapy, medical equipment, inpatient rehab, all of that? Is that so?
100%. So that's
Yeah,
something absolutely that discharge planner should be helping you with too. Their insurance may very well cover in-home care, PT,
yeah.
OT, but often, same with durable medical equipment, walkers, wheelchairs, but in a lot of cases, they will require a referral or a prescription from the physician. This is very important for a lot of people post discharge, and having worked in skilled nursing facilities, I know this can be challenging at sometimes, but certain prescription medication needs certain types of paperwork, forms, signatures, because of the nature of the medication. And so if your loved one, even if it's a hip replacement and they're coming out and they're going to a rehab, really making sure that before they leave that the script is written for that pain medication, so they're not in a situation where there's a lag time, because
Mhm.
when you're in pain, every minute really feels much longer. And I know that's something that all of us are very sensitive to and really want to protect the people we care about from
Mhm.
having to deal with.
Absolutely. Great point, Perry. I think we're at time, but the last question, which I think is really important, is who do I contact if I have questions moving forward? I guess this relates to the earlier part of our discussion, but this is a really sneaky important question in my opinion, because you're gonna have questions, and like we talk about in any caregiving situation, when we have questions or we're feeling uncertain, we need to ask, we need to surface those things. So finding out who the contact person is, and being as thorough as you can. Who do I talk to when I have questions after the fact? When are they in the office? Like, are they Monday through Friday, 8 to 5? Like, who covers when they're not there? Like, I would ask for as much as to your point earlier, as much as you can get, take it, but don't be
And write
shy
it
in
down.
asking it. Right. Yes. Write it down.
And write it
Exactly.
down.
For sure. For sure. So I think we're at time now. Of course, the audience has sent in a few questions. We're unfortunately out of time. I will be following up with anyone that asked a question to get you the answers that you need to these questions. As I mentioned a few minutes ago, we do have that handout, hospital discharge checklist. Please do download that. You can email me. I can send you a copy. My email's in the invite. And I hope you can join us for the February session, which is, let me see the date real quick. I think it's on the 23rd of February. And we're going to be talking about 5 must-use tips for a dementia caregiver. So it should be a great session, and hope you can join us then. Thank you so much for joining us today. And Perry, as always, it was a pleasure. Thanks for joining.
Thanks.
Okay, take care, everybody. Bye now.